So the question is, what is functional chiropractic? We are here to help the person, to help the patient, not just to use a particular form of treatment on the patient. The idea is when the patient comes in, they're telling us what their problem is. They tell us where it hurts, what is weak, what they cannot do any longer, or what hurts when they do something specifically. So the goal of the functional chiropractor is to really look deeply into what's happening with the patient, okay? And then start breaking down the why is it happening. Where a lot of other techniques or a lot of other methods, they just say, okay, well, you need your spine adjusted. Or massage therapy might say, okay, well, if that muscle's tight, let me release it, let me relax it, what have you. Physical therapy might say, okay, let's find out what's weak and let's exercise that muscle. But in functional chiropractic, we want to take all three of those approaches and say, what area of the spine do we need to address? What nerve is affecting that muscle? Is that muscle tight? Do we need to do massage therapy on that muscle? Is the muscle weak? Do we need to do physical therapy on that muscle? So the combination of these three dynamics is what makes that functional chiropractic very unique. If you like the topic of this video, let me know. We are just starting this out and we want to make sure that this channel is providing you as much information as we can and then being of value to you as much as we can. There's multiple reasons that people may need chiropractic. We look at a lot of sports and a lot of fitness minded, but we work on a lot of families as well. Maybe the driving, maybe the amount of time they're sitting in the car on the flight, maybe they're an office worker and they're starting to get tighter in their lower back. They could pull a muscle in the gym, but they don't understand why. They might have some pain before the workout, they might have pain during the workout or even after the workout, and they don't know where it came from. So there's so many reasons why pain occurs. For us to try to analyze why it all happens, it's an endless pursuit, because you would have to see every single movement of what the person does every single solitary day. But ultimately, the reason for the pain is something is not working to contribute to the robustness of the patient. What is happening is that certain muscles may be tightening up to protect an area. Maybe they have shifted their spine just enough to create irritation on a nerve root, and it starts to weaken one of their hip muscles. Right? Whether it be in the front of the hip or in the rear, and it no longer is able to stabilize that lower back and that pelvic region as well as it should. Now, you go for a walk, right? Even down a hallway. Every step you take is going to feed that dysfunction. Every single step. Now that hip is not stabilizing. So that hip doesn't stabilize as well as it should. Another muscle has to pick up slack for it. It starts to tighten up to protect, right? Another muscle might weaken a little bit further. Now that dysfunction might go up the chain a little bit. Now all of a sudden, one of their arms doesn't swing as much as the other arm did. And it's all because of that one hip. Say the right hip is not doing enough and it's starting to tighten up, which tightens up the left shoulder blade. All right, now this isn't doing what it's supposed to do, and it starts to tighten up this shoulder, this trapezius muscle, and it starts to pull on the neck. And then all of a sudden, the person comes in and they're like, man, I've got this neck pain right here, and right here my traps and shoulder area is tight. But then when we start looking at it, we trace it and go, okay, well, that side of their neck is tight. And then we say, well, why is that? And all of a sudden we notice that the shoulder is not as stable as it needs to be. And then we trace it down and we go down to the lower back and then we find out that the hip isn't as stable as it needs to be. We watch them walk and go, wow, that's a little, You're swinging that one arm more, you're not swinging that other arm more. And we look at that, and that's how we actually see why they're in pain. Because pain is not a coconut just falls out of a tree and hits us in the head. Rarely is pain just happen like that, okay? Unless it's a very specific injury, maybe a car accident, things of that sort. A lot of times, majority of patients that come in, they're talking about they just have a little bit of extra tightness one day, and then it got worse and worse and worse until they wake up one morning, it's a lot of pain. And it's my job to figure out where the problem is and then design an entire program to solve those problems. So the very first visit, when people come in, we want to take them through a movement exam as long as they're capable. Obviously, the person who can barely get up and down, we're not going to make them do a movement. But we like to take them through a movement exam, which includes walking, gait assessment, because we want to see how their spine and their hips are working when they're actually walking, both slowly as well as fast. We want to take them through some basic sit to stand, sitting down, standing back up, maybe an exercise squat. We look at how they are able to balance on one leg. Do they have full range of motion in their upper body, right? We take that initial look at how they're actually moving, what we call a functional exam. Then we start and we put them on a table. Now we're going to start looking a little deeper. Now we're going to see if the spine is moving the way that it's supposed to. Then we're going to make sure there's no predisposing injuries or anything that we need to be a little more concerned about. So we're going to take and do some provocative exams to make sure that it's safe to adjust and actually safe to do the treatment that we want. Then we're also going to be doing something called a neurophysio or a neuromuscular exam. This is probably the biggest portion of our method here. This is what dictates why those muscles or the way the body is working in the functional exam. Say we see something in their squat. Maybe they shift too far to the left, or maybe their hip hikes up on the right. Well, there's a reason for that. And we're always asking the question, why? Well, why is that muscle doing that? So ultimately, we're trying to get to the point where the patient and the client is not needing to come in to treatment as much. They are walking. We have gotten their walking pattern back to as best as we possibly can. They're able to do their functional movement patterns as cleanly without pain. They're able to go to the gym. They're not having pain. They're walking. They're walking their dog. They're walking with their kids. They're doing everything. They don't have pain. They notice that their endurance increases now, not only from a physical side, but pain and stress and things like that just really weigh us down in all kinds of different ways. And as the whole person, they just start living more vibrant, happier, much more functional lives. And that's my job. You know, at the end of the day, we get you to that point and we just want to keep you at that point. We want to keep you at that high performance level. If you or someone that you know or care about is having any type of problems, any kind of nagging issues, if they feel they can't figure out, have them get in touch with us. Go to the website, go to our Instagram page, check us out. It's easy to get in touch with us and get an appointment. Give us a thumbs up, give us a comment, tell me what other subjects or questions you may have. Hopefully you join right along this journey with us. Thanks for watching.